I am amazing Rita, and with me in the studio is Dr. Dimma Favor. Hi, Dr. Favor.
Hello,
How are you doing today?
I'm good. How are you?
I'm excited.
I can see.
So tell us, Dr. Favor, what is endometriosis?
Endometriosis is a gynecology case that involves or that occurs when the lining of the uterus, the endometrial lining, the endometrium, is the endometrial tissues are growing in another part of the body that is not the uterus. I don't know if it's making any sense.
It's making sense.
Yes, this is the uterus now. And then the lining of the uterus, these tissues that line the uterus, they grow somewhere else in another part of the body. That's what we refer to as endometriosis.
So, but I've heard that when some women, when it's happening to some women, they'll be feeling pain under here. Is it true?
Yes, that's one of the symptoms you can see in
Okay.
endometriosis.
Okay.
There are different symptoms that come with endometriosis. However, there's no particular symptom that is, how do I put it now, pathognomonic. Like when you call this symptom, you say it is endometriosis. Yeah. But then there are some symptoms that are associated with endometriosis, like the
bottom
pelvic pain.
But how
yes.
is it different from menstrual cramp?
The difference is this: the intensity of the pain, the pelvic pain that comes with endometriosis is more intense than than the one that comes with normal menstrual cramps. That's one. Then secondly, the pain from endometriosis is usually cyclical. When I mean cyclical, it comes like in a cycle. It comes during the period of menstruation.
Okay.
Menstruation. Exactly. While the menstrual cramps pain comes, usually it comes with the period. Exactly. Then another difference is this: the pain that comes with endometriosis, I've talked about the intensity, right?
Yes.
It's more intense than that comes with normal menstrual cramps. Then there's a third difference. The other difference I will talk about is the pain that comes with endometriosis. Usually it can extend. It will not just limit itself to the pelvic area, while that comes with menstrual cramps is usually affecting the lower abdomen. But this one that comes with endometriosis usually occurs around the pelvic region, the upper thigh. So these are some differences between the pain of endometriosis and that of menstrual cramps.
What causes it? What causes it?
There's no particular thing that's been picked out to say this is the cause of endometriosis. However, there are some risk factors like family history. Family history is usually a great risk factor for endometriosis. Like when the mother, the sisters have endometriosis, you won't be surprised to see it in the individual.
Yeah.
Another thing is hormonal issues. When there's anything that causes estrogen spike. Estrogen is like the hormone responsible for endometriosis. So hormonal imbalance is one of the risk factors for endometriosis.
So how common is that all, please?
Some people talk about, though it's not yet proven, but some people talk about retrograde menstruation. Retrograde is just like an English word, backward. The backward flow of the blood. Instead of the blood coming out, is having a backward flow. So some people link it to endometriosis. However, it's not yet a proven risk factor.
Okay. So how common is it with women of reproductive age?
Looking at statistics, they said about 10% of women have endometriosis. If I had to look at 10%, it's something like 1 in every 10 women have endometriosis. Yeah.
Okay.
Then remember, this 10% we're talking of is in women of reproductive age. Yeah, so that's the catch. They're women of reproductive age, not someone who is postmenopausal, and then you'll be looking for endometriosis in that person. Yeah, so this 10% deals with women of reproductive age. Yeah.
Okay, you talked about the lining of the uterus growing somewhere else.
Yeah.
So what happens in the body when someone has endometriosis?
First of all, it depends on the location where these endometrial tissues have deposited. Yeah. So there could be things like inflammation. There could be severe pain, intense pain, or cramping of the muscles around that area. There could, if it's let me assume now it's growing somewhere like in the bladder.
Hmm.
With each period, the person will pass bloody urine, hematuria.
Hmm.
Do you understand? Because when these tissues are shed off, is what gives rise to menstruation. When the endometrial lining is shed off. So imagine this endometrial lining in another part of the body. When that person is seeing the actual period, when the person is bleeding, this if these tissues are deposited like in the bladder now, the patient will be having hematuria, that's bloody
Blood in
urine.
urine.
So it depends on the location where these tissues are deposited.
So tell us, how does endometriosis affect the uterus, the ovaries? You just talked about the bladder.
Yeah.
So what the uterus and the ovaries?
Okay, for the uterus now, endometriosis cannot occur in the uterus. Remember our definition. Endometriosis is when the endometrial tissues are growing in another part of the body that is not the uterus.
Okay.
But now, when it is occurring in the uterus, you refer to it as adenomyosis. When there is excessive growth of that endometrial lining, when it's excessively growing in the uterus, you call that adenomyosis. You no longer refer to it as endometriosis. Endometriosis is still the same thing, but then it is occurring in another part of the body that is not the uterus.
Okay.
I don't
So,
know
but
if
if it's
clear now.
occurring in that other part of it, can it affect the uterus?
What do you mean affect the uterus?
Like,
Okay.
is there a way it can affect it? Maybe the reproduction side of it.
Okay. Is this maybe causing something like infertility?
Yes,
Okay,
yes. Can it affect the normal function of the uterus?
All right. Now I understand your question. So you asked for its effect on the uterus and its effect on the
ovaries, yes.
Yes, in the ovaries, first of all, it will form something they call endometrioma.
Okay.
Endometrioma is like a cyst. It's like a a cyst is a fluid-filled cavity.
Okay.
Yes. So it forms endometrioma in the ovaries.
Okay.
And then the reason why there's like one of the aftermath or one of the consequences of endometriosis is infertility. It's not like it's the uterus in itself that is being affected. But the reason infertility comes in is because this instead of getting eggs in the ovary, what you now see is endometriomas. You see cysts. And so sperm cannot fertilize the cyst.
Yes.
So there's high risk of infertility. Another reason why infertility comes in is that this endometrial lining, these tissues that line the endometrium, they can grow in the fallopian tubes and then they can cause scarring. And when there's scarring is a risk factor for infertility. So these scars will not allow fertilization to take place. It's not like the uterus in itself is being affected.
Okay.
Yeah, so that's the catch on how infertility comes in, or how infertility is an aftermath of endometriosis. Yeah.
Okay, can you tell us some of the signs of endometriosis?
Okay, some of the symptoms.
Yes.
Yes.
We talked about pelvic pain. Yes,
Exactly.
the symptoms.
So pelvic pain is one of them. There could be dyspareunia. Dyspareunia means painful sex.
Okay.
Yes. There could be dysmenorrhea. Dysmenorrhea is painful menstruation. There could be heavy bleeding, menorrhagia. During their periods, they bleed heavily, very, very heavily. Then, depending on the location where these endometrial tissues are deposited, like if it's in the bladder, this person could be passing out bloody urine. There are some people that these endometrial tissues deposit in the lungs, in the chest region. So these people have accumulation of bloody fluid in that region. And then it gives rise to things like dyspnea. They'll be having difficulty in breathing. They'll be having chest pain, because imagine bloody fluid filled in the lungs. When oxygen comes, the lungs cannot expand properly. Even though the person is taking in sufficient oxygen, but then the lungs will not be expanding properly because fluid is already contained in the lungs. So this person comes down with difficulty in breathing. That's the dyspnea, the chest pain. So it also depends on the location where these endometrial tissues are deposited. But these are some symptoms you can see in the individual. Yeah.
So, but that doesn't mean, like you said, that every severe pain a woman feels at the pelvic region means that that's endometriosis.
No, 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 no. Feeling a severe pain around the pelvic region does
Mm.
not all. It does not almost always give it out that this is
Endometriosis.
endometriosis. Yes, you can't just see someone with pelvic
Mm.
pain and then say person
Okay.
is having
So
endometriosis.
can someone have endometriosis without pain at all?
Yes, it's possible.
Oh.
It depends on the severity. Someone could be
Okay.
having mild endometriosis, and then this person will not come down with severe pelvic pain. So it's a possibility.
Okay. So how does endometriosis affect sexual health and intimacy? You know, you've talked about pregnancy that it
Yeah.
can actually affect fertility.
Fertility.
Yes. So, but you also said it can cause pain during sex.
Yes.
So tell us how it affects it.
Okay, imagine a woman now who always feels pain when having sex. She no longer sees it as something she will want to engage in because she's trying to avoid the pain. Then imagine all the symptoms that come with endometriosis. Imagine if it's a patient now who is having the severe form of endometriosis and then she's having severe pelvic pain. She'll be thinking of how to sort out this pain. At that moment, sex will not be what she wants.
Yes.
So you can see that it has a way of affecting sexual life, intimacy, because she's trying to sort out these issues. Imagine her bleeding heavily, and then she's thinking of ways to sort this out. Imagine having like we said, the severe pelvic pain that is usually cyclical. It comes with periods and all of those. She's thinking what is occupying her mind is how do I get rid of this pain? What's the solution to this pain? Because the pain is usually very
Severe.
intense, such that over-the-counter medications
Might not
does not
work.
help at times. Yes, sometimes they need to get injectables to help them calm the pain down. The pain is very intense. So at that moment, what will be in her mind will not be sexual intercourse. What will be in her mind will be a way to sort out this pain, to sort out the heavy bleeding and all of those. So it actually has a role in affecting intimacy or sexual life.
And imagine for someone that is probably looking for a child, or
Exactly.
you know, it's
She'll be
already
frustrated.
the
Get
chances
into
are getting
depression.
lower.
Exactly.
So tell us about endometriosis and hormonal imbalance.
All right, for endometriosis and hormonal imbalance, the major hormone that is powering endometriosis is estrogen. Yeah. So in someone having endometriosis, there's estrogen surge. Estrogen is very high, while progesterone is reduced. And then recall when estrogen is very, very high, it sends a kind of it gives a feedback mechanism to the brain, telling the brain that there's a surge in estrogen. So there's a link between estrogen and then remember I said progesterone is reduced. So instead of them being normal, there's a rise in estrogen and then a fall in progesterone. So this is what brings about the hormonal imbalance in endometriosis.
Okay. So how is it diagnosed?
Okay, for diagnosis of endometriosis, you want to start with the history taking. In history taking, what do you want to find out? You want to find out, do you have severe, intense pelvic pain that is cyclical? It comes with your period, like it's cyclical. You want to find out if there's positive history of that in the patient. You want to find out if there's dyspareunia, that's the painful sex. You want to find out if there's dysmenorrhea, very painful menstruation. You want to find out the heavy bleeding. You also want to do some physical examination. In physical examination, you want to elicit tenderness, where you're trying to see if this person is really having the pain. You want to elicit the tenderness. Then you can send for some investigations, but then the how do I put it now? The most important investigation to help you make diagnosis of endometriosis is laparoscopy. In laparoscopy is a kind of is a kind of minimally invasive procedure. It's invasive because you're not doing it from the outside. Yes, you have to look inside. We call it minimally invasive because it's not like you're opening widely. Do you understand? You're just
Yes.
looking through to see if you can find those endometrial tissues, endometrial lining in other parts of the body. Example, the fallopian tubes, the ovaries. That will help you look and see if you can find it. So that's the most important investigation to make diagnosis of endometriosis. You can equally do transvaginal scan. The transvaginal scan can show you all the areas from the vagina through the cervix, the fallopian tubes, the ovary. It can show you if there are endometrial tissues deposited in those areas. So these are some ways you
You
can
can diagnose it.
Exactly.
Women that take birth control pills, is there a way it affects endometriosis? That does it support it or it kills it or does it
Okay.
worsen the whole situation?
Birth control pills are one of the management
Okay.
protocols
Okay.
for endometriosis. Yes, it can actually help in managing endometriosis. It does not worsen it. Yeah.
Then what is the connection between endometriosis and conditions like fibroid and PCOS?
I would say the connection between endometriosis and fibroid, estrogen is the powering hormone in the both of
For
them.
both of them,
Yes.
yeah.
While for PCOS, remember I said in someone having endometriosis, when the person gets so stressed, cortisol is released. Cortisol is the stress hormone, which has a way of being how do I put it now, converted to androgens. And in PCOS, androgen is a major culprit because androgen surge, remember females have androgens but in little quantity, while males have androgens in very high amount. So when there's androgen, it causes the anovulation we see in PCOS. And then when someone having endometriosis is stressed, cortisol is released in very increased amounts and then converted to androgens. It can also play a role in that infertility. It's one of the means through which infertility can occur in someone having endometriosis. So the link between endometriosis and fibroid is the powering hormone, which is estrogen, while the link between endometriosis and PCOS is the androgen surge.
Okay.
Yeah.
And after treating it, not let me not say treating it, after trying to
Manage
the symptoms,
Okay.
and okay, you said it doesn't go away. Does it go away finally?
No, you cannot. Endometriosis
What of
does not.
surgically?
Remember I said the surgical approach to it is the laparoscopy, where you find the endometrial cells and then you try to take it away. It's possible that you won't even see all because it's a minimally invasive procedure. Yes, so those endometrial tissues remaining can further multiply.
So why is it important for women to check for endometriosis early enough? Especially if they are having severe pain.
It's important to check for endometriosis early enough to avoid the aftermath of things that come with it, like infertility.
Okay.
Yes, someone that knows that he or she is having not he or she, because a male cannot have it. Yeah. So someone having severe lower abdominal pain, having severe cramps during periods, having heavy menstrual bleeding, it's very possible that endometriosis could be there. So why not go for appropriate checkup or see your healthcare provider just to prevent what can be prevented, in order not to start trying to
treat what could have been prevented.
Exactly, and then to prevent things like the infertility and what have you.
Lastly, before we go, why is there not so much awareness about endometriosis? Because we hear awareness about fibroid, PCOS and the rest, but it's just as if endometriosis is to some people they don't even know about it. They will just probably feel that pain there, they will feel pain during sex or after sex, and then they feel like it's a normal thing. Yeah. Why is there no much awareness about it?
I can say the reason why there's no awareness for endometriosis is because, like you said, people just maybe they feel the cyclical pelvic pain and then they just assume this should be one of the things I see with my period, and then they don't bother going further to do further investigations or see a doctor about it. Exactly. Also, there are no health talks like health talks, public speakings on it, just like the way there are on PCOS, fibroid, cancer, ovarian cancers, and the rest. If you notice, we even mark World Breast Cancer Day, World So Cancer Day, but then I don't think there's a particular day mapped out for endometriosis. So these are some reasons why it's not so, the awareness is still low.
Okay, so if you've heard from Dr. Favor, if you know that you've noticed severe cramps around your pelvic region and it's cyclical, that is, you always notice it at a particular time in your cycle and everything. It comes and it goes, maybe it comes and goes, probably stays for long and everything. You're noticing pain, not normal pain. Although there's nothing like a normal pain. If there's pain, there's something wrong.
Exactly, there's no normal pain.
There's no normal pain.
Yeah.
So please do well. If you don't, maybe someone in your family has suffered from endometriosis, it's time for you to go and check before, so that you can start working on it or working on yourself on time. And once you notice anything around the pelvic region, especially if you're in your reproductive age, and especially if you are intending to give birth to a child, you should see a doctor immediately, and so that you can start your treatment plan as soon as possible. Don't take it for granted. And if you see women complaining to you about pains and the rest, you can actually share this video with them and let them learn a thing or two. Thank you so much for hanging out with us on Health and Blog, brought to you by Lifeway Medical Diagnostic Hub. I am Amazing Rita.
And I am Dr. Timba Favor.
So we'll see you in our next video. For now, it's bye.